I know, it is slick. It is slick. I'm going to try not to fall. All right. Good morning, everybody. How are we doing? Do you like the sunshine? We just brought it in just for today. So I'm really excited. Welcome to Fight Colorectal Cancer's United in Blue installation. We are so thrilled that you are here to join us. At Fight Colorectal Cancer, we fight for a cure, and we serve as relentless champions of hope for all affected by this disease. We support patients, we push for impactful policy change, and we are fighters for breakthrough research endeavors. We are so honored to be here today in front of more than 27,000 flags, and each flag represents a person. We heard this year that it's projected that by 2030, 27,000 people will hear the words, "You have colorectal cancer." It'll be the number one cancer killer in the United States if we don't do something today and now. And so we're here together to fight to make that projection not come true. And we have an opportunity to prevent it by working together. We are so excited to have all your faces here. We have caregivers, advocates, researchers, all here together to prevent this horrible statistic that was reported for those between 20 and 49. And we have 8 years to fight this. Surrounding me are individuals, but we also have over 700 tributes that were submitted across the country of caregivers, survivors, fighters, in memory and in honor of so many amazing families. Earlier this year, Fight Colorectal Cancer released and published our next steps, our path to a cure. And when I say our, I mean the universal our, the colorectal cancer community. This fight is much larger than one organization, one person. We have to all work together. We have to work with the NCI, the CDC, the FDA, with every single colorectal cancer group that is in the fight against this disease. And I am so proud to have so many organizations here, from healthcare organizations like the AGA, ACG, American Cancer Society, organizations like Blue Hat Foundation, Colorectal Cancer Coalition, and so many others that have joined us, like the Colon Club. And that means a lot to us because this fight is so important. And these lives behind me, when you look at these flags, are so critical to each of us. We're here together to fight. We're here together to push for policy change. And we are urgently asking for our members of Congress to fund cancer research and implementation science on behalf of these survivors, on behalf of these individuals we want to save. I'm so honored today to have amazing speakers, amazing champions. Our first speaker and champion is Dr. Ned Sharpless. He was appointed to the NCI as the NCI director in 2017. He's the 15th NCI director. And I do want to say one thing. I'm not going to read his bio. I think we actually know how amazing he is and his credentials. I do want to point out that he invited me to be a part of the National Cancer Research Council as a part of NCI, one of the only boards, the highest committee of advocates, sharing their opinions and thoughts and concerns around not just colorectal cancer, cancer. And when I was invited to be a part of this council, I was so honored, actually. I had been diagnosed with cancer 2 weeks prior. And when I heard those words, like, we want you to share your voice and to share the voices of colorectal cancer patients around the country, it was so meaningful. So thank you for being someone that listens to patients, someone that fights for a cure, and that really listens to our researchers who are right alongside us, who are wanting to make lives better across the country.
Good morning, everyone. What a beautiful, perfect day for this. And I want to thank Fight CRC for inviting me to come speak today. And I want to thank them for their work on behalf of patients with colorectal cancer. I think we all share this common mission of ending cancer suffering for all patients, including patients with colorectal cancer. I'd also like to thank Anjee for her work on behalf of cancer advocates. This board she mentioned is truly important, and her voice has been terrific to have. So thank you, Anjee. If you'll allow me to sort of wax nostalgic for a little bit, I want to to talk about sort of my history with colorectal cancer, and because my old boss, Richard Goldberg, here is sitting in the front row. When I started out in this field, there was sort of one-ish drug for patients with colorectal cancer, and it didn't really work that well, 5-FU. And I remember we would go to these like 3-day meetings to talk about how to give 5-FU, by long infusion or all at once or, whatever. And it didn't really matter that much. It wasn't a very effective therapy. And in the years since, in the last 20 years or so, I counted on the FDA website, we now have 15 drugs approved for advanced colorectal cancer, and some of them are quite effective, including, oxaliplatin and that regimen that, Dr. Goldberg and others helped develop for patient use and has been so important. So I think it's fair to say there has been some progress in colon cancer in terms of therapy. There's also been progress in terms of screening. I think we've had a much greater uptake of colonoscopy and other forms of colorectal cancer screening in the last 20 years, although we still have a ways to go in that regard. So it's fair to say right now there has been progress in colon cancer and a reduction in colon cancer mortality, but I think it's also accurate to say that we still have a long way to go. We still have far too many people dying of colorectal cancer, on the order of 53,000 deaths in 2019 as per SEER. We still have a significant racial diversity in outcomes. We have far too many Black and African American patients dying of colorectal cancer. We have lots of populations that are unscreened. And as Anjee mentioned, we have this very scary epidemiology of an increasing rise in colorectal cancer death in young people. Something that I don't think we fully understand scientifically, and something that the NCI is committed to studying and addressing and getting to the bottom of this, because we, like Anjee, think this is a national crisis. So against that backdrop of some progress, but yet the still fact that we need to do a lot more, I think it's a good time to take stock of where we are in cancer research in general and where we are in colorectal cancer research. And from my point of view, it's really galvanizing. It's really wonderful to have a president and have an administration that says ending cancer as we know it is a top domestic priority. So I want to thank the President, the First Lady, and the Vice President for their leadership on this important topic, and it's good for all of us to hear. I also want to thank the support from the people in that building, Congress, who have appropriated to the NCI very generously the years I've been in cancer research, including this year, where our appropriation is, I would say, quite good, thanks to the support of Congress. So I understand there'll be some members here later, so make sure you thank them for their support of the NCI, because this is really important. This is where the paradigm-changing discoveries come from that really help with cancer research. So thank you to the President and thank you to Congress for their leadership. I want to talk a moment about screening, and I've been very pleased that the First Lady in particular has taken this on to speak so forcefully on this. During the pandemic, we think we missed on the order of 10 million cancer screening events. This is screening for cervical cancer, for lung cancer, for breast cancer, and for colon cancer. And we as a nation, I don't know if we have the capacity to really make that up. So I think we all have to agree to try and make that fact of so much missed cancer screening as minimally bad for our patients as possible. And so I think it's a real national issue to try and get everyone back to screening as quickly as possible and to miss up those missed screenings, which we know are so important for colorectal cancer patients. And one important development in this regard has been modeling out of the NCI on when screening works best at what age. And so recently, work from the National Cancer Institute led the United States Preventative Services Task Force, which makes recommendations around cancer screening, to reduce the age for screening from 50 to 45. And we believe this is a very important development that will have some effect on earlier onset colorectal cancer, although still won't do much for patients younger than 45 in an area where I think we still need continued focus and research. So everyone who cares about colorectal cancer or any cancer, I think, has to realize this is an exciting time for cancer research, but also a time where we need to do much more. So I want to join with Fight CRC in pledging the NCI's steadfast commitment to making progress in this disease and to saying that nothing will stop us in our regard, in our efforts to try and end cancer suffering for all patients, including patients with colorectal cancer. So thank you so much for having me this morning.
Thank you, Dr. Sharpless. And that was on the record, on live stream. We are in this together. So thank you so much. And it means a lot. It means a lot that our administration is behind us. The leaders of this organization is with us. And so we are thrilled to have you join us. So next, we have one of my favorites, Congressman Davis is joining us, and I always share this story. I know you know that I'm going to share this story. So not only is his wife a Lynch patient, and he is a true champion for colorectal cancer because he knows what's at stake, but we met him. Where is Candace Henley? Candace Henley and I were walking the halls of Congress. We had I Heart booty bracelets on. Congressman Davis stops us in our tracks and he says, I heart booties too. Come to my office at 1 o'clock. And I said yes. And he has been a relentless champion on behalf of patients around the country ever since he stopped us in the halls of Congress. And that's what advocacy does. So Congressman Davis, please do join us.
I'm actually on an ag committee hearing at the same time, so I apologize. I'm trying to make sure I don't get kicked to the back of the line when it comes to question time. But I do want to say I remember that day, and I remember seeing the Fight Colorectal Cancer bracelets and tags and lanyards and shirts, and I wanted you to know I know exactly what you're doing. I know exactly why it's important, because I can still remember the day that my wife got that terrible diagnosis after being misdiagnosed for months. You know, who thought a 26-year-old would have colon cancer? No, it's something here. It's got to be this. It's got to be a blood disorder. It's got to be maybe Crohn's disease. One time, even a doctor, former primary care doctor, told her it was in her head. But like many of you, she didn't stop. She went ahead and said, I know something's not right when I can't walk a flight of stairs without getting winded. And when that 5.9 hemoglobin level came back, she knew something was wrong. But it still took weeks and months to be able to get that final diagnosis. And I remember that day walking in after a colonoscopy and her still groggy and saying, it's cancer. At the time I was 29, she was 26. We had a 2-year-old daughter. Everything goes through your mind. We lived it, just like many of you, every single day. But the fight doesn't stop, and that's a message that's got to get out when you're done with this day to unite against fighting colon cancer. You got to go back to your communities. You got to remind everybody in the media that when you talk about your journey and this fight, that it never stops. We are 23 years post my wife having surgery and 6 months of chemo and being cancer-free. And there was just there's an issue with our local clinic where we get our providers and our national insurance. So we had to switch companies. And one of the local news media outlets is doing a big story on that. And in the story, I talk about how my wife fought colon cancer with this clinic and with this company before. And they say, well, Davis brings up his wife's colon cancer every time he talks about health care. You damn right I do. Because her fight and her journey and your fight and your journey doesn't stop when you get your cancer-free diagnosis. 23 years later, we still have to be concerned about what's the coverage going to cover when it comes to my wife's screenings to make sure she's still okay. And being a Lynch patient, what about the screenings for my kids? These things matter. And this fight doesn't just start when we talk about how we reduce barriers to getting tested to get diagnosed. That fight continues every single day for everyone who's ever fought this deadly disease or had a family member do so. And that has to be part of our message out here. And it's not just colon cancer, it's every deadly disease. The battle never ends. But so many want it to be just a talking point. They want to say, oh, this is all politics in the case of me and my family and my wife. And it's wrong. And I need your help to change their attitude. But I got to tell you, this fight that you wage out here in Washington, D.C., I'm so glad COVID's over and we are here in person because I want to see you back in these buildings. I want to see you walking around with the I Love Booty buttons on. I want to see you walking around in blue. And I want to be able to take each and every one of you to my new friends, new members of Congress that need to understand the impact of research dollars and the impact of of getting screening and the impact that my good friend and partner in this, Donald Payne, and I have had working with each and every one of you. We've got to continue to remove these barriers. We've got to continue to fight, and I need your help, and I will never walk away from helping you. So the next time I see you out here, the next time I see you in the hallways, let's just both scream, what? I love booty. Thank you all.
Thank you so much, Congressman Davis. I do want to point out that, our members of Congress are here to represent us. They have families, they have people that have been in their lives touched by colorectal cancer. And our jobs as advocates is to connect with them and to nurture these relationships and to remind them that they are champions on behalf of us. So I really want to highlight that our congressional champions are in it with us. Next, I'm really excited to bring up Dr. Danielle Carnival, who is from the White House. This year, many of us watched the news when President Biden announced the extension of the Moonshot program. And I know that when we watched it as a staff, we were thrilled to see the commitment by this administration and the work that would be done and the emphasis on prevention as well. Dr. Carnival has been amazing. Honestly, and I watched her do a presentation at NCRA, and I was so full of hope that there was leadership in the White House that was not just, she's a PhD neuroscientist, and I was like, oh, that's amazing. But when she said, I'm in it to cure cancer, I'm here and my team is here to hear from advocacy groups and cure cancer. I literally got goosebumps when I heard that. And so it is truly a pleasure to bring her here. She is leading the charge at the White House, and we are so grateful that you took the time to join us.
Well, good morning. It is good to see so much beautiful blue and this amazing display representing so many lives behind us. We have a lot of work to do. I'm so glad to be on this stage to bring awareness to colorectal cancer. Unfortunately for me, I learned about colorectal cancer at an early age. My strong giant of an uncle, the one who always had a piece of candy for me and all my other cousins in his pocket, came crashing back down to earth with a colorectal cancer diagnosis before he reached the age of 40. I think I was 7. When he passed, he left behind my aunt, a nurse who might be the strongest person I know, and his 7 children, one younger than me at the time. I wish I could say that that was the only time that this diagnosis impacted my family. About 20 years later, his son, my cousin, was diagnosed also under the age of 40, and unfortunately with the same result. Now, for those of you screaming on the inside, look at the genetics. We did. It took 3 generations of cancer deaths, 2 before 40, in my family for someone to look further and see what was going on. And because of scientific advancements, we now understand the prevalence of colon cancer in my family, in some parts of my family, and in our case, because of Lynch syndrome. That news was devastating, but also empowering, because we had knowledge now. We had knowledge for the rest of my cousins and my extended family to take action and to really have a role in their own health care. And because of that, we have not yet had another funeral for this disease. So that's progress. I tell part of my story here because this is personal. I don't need to say this to the faces sitting in front of me, but this is personal to me, like it is to you, like it is to the president and the first lady and the vice president who lost her mother to this disease. It's personal for nearly every American family. That's why so much action does happen in Congress. This is a bipartisan issue that touches us as human beings. And that's why I'm so excited that we took this back on from the White House in great partnership with Dr. Sharpless and the National Cancer Institute, who fights this and works to get progress every day. In February, as mentioned, the president, the first lady, the vice president, half of the cabinet were at the White House for a commitment to reignite the cancer moonshot. What that means for us is setting new goals. Like you all have goals here around reaching younger people with messaging around colorectal cancer, prevention and screening. We set new goals to decrease the death rate by cancer by at least 50% over the next 25 years, and to improve the experience of people and their families and caregivers living with and surviving cancer. Internally, what that means for us in the government is that we're going to get together actually this afternoon for the first time as the principals of the Cancer Cabinet to really finalize and set the agenda for what this looks like from us. But a whole part of what we're doing is listening, gaining the perspectives from this organization, from all of you who know this so deeply and personally and have become experts in this disease. We want to know where the barriers are, what more the federal government can do, and what we should be asking of others. This is going to take all of us. We set out 7 pillars as a shared agenda for us to all measure our progress. That includes cancer screening and early detection. It includes cancer prevention. It includes addressing inequities and disparities in access to quality care, in access to good outcomes from a cancer diagnosis. It includes targeting treatments to the right patients. It includes, with NCI, developing new ways to find answers for those cancers where we don't currently have a good treatment. And most of all, it includes better supporting patients and caregivers and their families and learning from more patients. Throughout this journey, unfortunately, you become an expert in this disease, and you should have a seat at the table, and as part of the Cancer Moonshot, you will. It's been mentioned a couple times, but it is worth saying again that one of the areas of focus and a place that we're putting a lot of urgency is on making up for the more than 10 million cancer screenings that were missed during the pandemic. We know the outcomes if we wait. We have to make sure that we are getting back on track, and the First Lady has shown a deep commitment to this, and with getting on the road and bringing the message to communities with Dr. Sharpless, Secretary of HHS Becerra, and other members of the Cabinet. We also need to provide more equitable access to early detection. In addition to, as I said, in addition to what we're doing on the federal government side, we want to be a platform to highlight the good work, new actions, and new collaborations from companies, organizations, healthcare providers, and all of you. You see that this moonshot is no less about innovation than it was in 2016. The development of new ways to prevent, detect, and treat cancer is still an essential component. But it is even more than we were able to do last time about making sure that more people in the United States have access to the tools we already have. And the good news is there's something we can all do. What you all are doing here today is an important part of the Cancer Moonshot and an important part of realizing the President's goals. Please get your recommended screenings. Rally your friends and family to do the same. Push on the researchers in your communities to work even more on focusing on delivering for patients. Reach out to companies who you know can be a better part of this fight, and make sure that your organizations are leveraging everything they can, like Fight Colorectal Cancer is today, to make progress on these goals and to deliver for folks facing these diagnoses. Doing all of this together and more, we can reach what the President says many times, that together we can end cancer as we know it. So thank you for your advocacy, and look forward to working with you.
Excellent. Thank you so much for joining us. And it was a perfect segue to talking about the role of researchers. Dr. Azad was appointed to the President's Cancer Advisory Council. And I first met her when we were working on a paper on early age colorectal cancer. And I was so struck by her empathy for early age onset patients. And I think that from a researcher to really want to put herself in the space of an early age onset patient and publish it is so important to us, because we need researchers to be a part of our journey and a part of telling our story. So, you know, from her voice to the White House, we're so grateful to have a relentless champion on our side. So please join us, Dr. Azad. Thank you.
Good morning, everyone. I am so honored to be here to help highlight Colorectal Cancer Awareness Month, and I really thank Anjee and the organizers for inviting me here today. I'm really here to talk to you as a doctor and as a scientist in terms of what it's been like for me to take care of patients for the last 15 years with colorectal cancer. Now, you all know from all of the programming today and from the lives that you live that colon cancer is the second leading cancer killer in the United States. We lose 50,000 people every year to colorectal cancer. But the beauty is that this is one of the most preventable cancers that we have as well. Colorectal cancer screening is extraordinarily effective at not just detecting colon cancer, but if a person undergoes a colonoscopy at the age of 45, as Dr. Sharpless just highlighted, that's a therapeutic procedure. Not only is it going to detect the cancer, but it actually allows us to remove precancerous lesions so that people never have to deal with this diagnosis. Now, if a person can't or won't undergo a colonoscopy, we have other options for screening too. A simple test done in the privacy of your own home, looking for blood in your stool. This is a kit that your primary care doctor can give you and you can just mail back, is also very effective at detecting this cancer. I was driving here today, stuck in DC traffic, and talking to my 46-year-old girlfriend on the telephone, telling her, have you gotten your colonoscopy? I'm going to this event right now. And she said, you know, I have my life. I've got 2 kids. We just had COVID. I work a job. My husband works. And she said, how far can I bump this out? Do you think I can bump it out to the summer? How about next year? I have a mammogram to get done. That's what ends up happening when it comes to doing colon cancer screening. It's not something people look forward to, but it is something that is easily done. And as advocates, I think what we can do is talk to our loved ones in our community to make sure that they are taking advantage of this wonderful tool that we have, this weapon that we have against colorectal cancer. The other thing that Anjee just touched on is that my panel of patients has grown steadily younger over the course of the last 10 years. I didn't know, and my colleagues and I didn't know as we talked about it, if this was just something that we were seeing in our clinics, but the statistics really bear this out, as Dr. Sharpless just mentioned. Colorectal cancer is shifting and becoming a cancer in younger and younger patients. 30% of colorectal cancer is now detected in people under the age of 55. So if you or anyone that you love is developing any new symptoms in their body, if your belly feels different, if you're having swelling, if you're having blood in your stools, if your stools are just changing, you need at that time to go see your primary care doctor. And you also have to help educate primary care doctors. We're all in that part of it together, that just because you're 35 doesn't mean that you don't deserve screening for colon cancer. The last thing I want to mention as a researcher, for people who are living with colorectal cancer today, people with advanced stage disease, there is significant progress and hope. There are literally thousands of researchers around the country, around the globe, that are working on new treatments. Much of this is paid for by our own government, by the investments that we're making, but we have partners in pharmaceutical companies, we have partners in advocacy agencies. This is work that's ongoing and has immense promise. We've talked about Lynch syndrome a couple of times today. 10 years ago, if your family had Lynch syndrome or if a patient had Lynch syndrome, it was just something that you had, but there was nothing that we could do that would be different because of that diagnosis. Today, if you have advanced cancer and Lynch syndrome, we have extraordinarily effective therapy that can actually cure this cancer and definitely render it a chronic disease for the majority of patients. That's a change that didn't exist just 10 years ago. So please have hope and reach out to your providers and doctors. Get access to clinical trials and experimental therapeutics. They are there for the taking. So I want to thank you again for inviting me here today, and I hope that every year we can get together and celebrate the falling numbers in colon cancer and the enhanced survival of our patients too. Thank you.
Thank you, Dr. Azad. We are honored to have you join us today. I want to take a second to say this is pretty amazing. You know, for those of you who are watching online or here, to have NCI, to have the White House recognize the second leading cause of cancer deaths, colorectal cancer, we have champions in these agencies, and it is pretty awesome. And that's part of our advocacy effort and our story, is that really changing the hearts and minds of people. And I think we are doing that. So we do have a lot of hope. So next, one of my favorites, Dr. Lisa Richardson. She is the Division Director of the Cancer Prevention and Control Program at the CDC. She's a medical oncologist and has been a servant, a public health servant for over 27 years. And I want to say this, I met Lisa over a decade ago. I've been in colorectal cancer for over 15 years. And when I met her, I met somebody who truly believed in health equity from day one and prevention. And I'm so honored that she joins us at Colon Congress every year. She's like, I got it on my calendar. Don't worry about it. I'll be there. I'll knock down doors. I'm going to be there. But the CDC does an amazing job of reaching communities across the country where people need screening. And I used to be in the state of South Carolina and ran a colorectal cancer screening program. The CRCCP program, which is our colorectal cancer screening program at the state level, was the one way states could get funding to reach communities in rural communities, address health equity issues. And she really championed the funding for that program. And thousands of lives have been impacted. That thousands of polyps have been removed. And so we are so grateful for your leadership.
Good morning, everyone. As usual, as all the speakers were speaking this morning, I checked off every single talking point that I had. All of them. But anyway, what I want to say, the one I'd like to start off with is just telling you a little bit about myself. And, you know, Anjee did, so now I can just go totally off script. But I'm a medical oncologist by training, and so I know what suffering is with cancer, taking care of cancer patients. So when I first came to CDC, 22 years ago, everybody I ever worked with who was a cancer doctor said, what in the heck does a cancer doctor do at CDC? I said, well, at the time I really didn't know what it was going to be like, but I was the medical director for the breast and cervical cancer program, the free program for women without health insurance. So I knew that the CDC was doing good work, but I also know even then that there are ways to prevent cancer. Even when I came to CDC 20 years ago, there was screening for cancer. So to Anjee's point, there really is a lot that we can do about, you know, cancer, period. One of the things that I think about as well, and, you know, a story I'll share is I'm working on a project to empower, just like this group, Fight Colorectal Cancer, absolutely amazing, to teach people and empower them about their health and what their choices are. And so one of the things that I talked about, you know, trying to express to them what I wanted them to go do, the contractors, is that when we talk with patients or we talk with family, friends, it's one person at a time, right? One person at a time. And I think all the numbers which I came forth with, I could come forth with more numbers, but all the numbers are people. They're not numbers, and we forget that. So one young lady said during the meeting as we were closing out the project, that part, she said, Dr. Richardson, I want to thank you because you said it's one person at a time. And because of working with you for the last 6 months, she went and got her colonoscopy done. So what I'm saying is don't think people aren't listening. They are listening, but things get in the way, life gets in the way, but, you know, just keep going at it, keep knocking at it and chipping away at it, and people are listening. You just may not. I have a 22-year-old son. I swear he doesn't hear anything I say, but every now and then he'll repeat something, and I'm like, all right, he's still in there, that boy that I love. But anyway, back to, a couple of things I want to tell you about what we're doing at CDC. To Anjee, Anjee mentioned the Colorectal Cancer Control Program, which we currently have in 30 locations, 23 states, and we also fund universities. And in that project, we did an amazing evaluation where we showed that all those things we say work, doctor reminders, all those things, quote unquote, evidence-based interventions do work. And in our last year of the program, those clinics that implemented all of those things that we recommend were able to increase their screening between 20 and 30% in those clinics. And those clinics are serving the people that Anjee talked about, those of low income, federally qualified health centers, those who just can't really, this is one of my other pet peeves, soapbox for a minute. Is that, we all care about our health. We just have different resources to go do something about it. And so what we do at CDC is we try to bring resources to people who might not otherwise have them, and also bring information to people in a way that they can understand it, not using 16-syllable words, but 3 to 4, 1 to 2. One of my favorite things is if you're briefing me, I like 3 lines, a bottom line up front, 3 bullets, and then let's talk about what's going on. I don't have time to read all that stuff. It kind of disturbs everybody, but you really don't have time to read all that stuff. So we have a paper coming out really soon. One other thing that I'm really passionate about are the people who have never been screened for colon cancer. The one thing we always talk about is who's not up to date, right? When we look at our data, and like I said, the paper will be coming out in June, 19 million people of, between 50 and 75, we need to redo the numbers at 45, 19 million people age appropriate eligible have never, ever been screened for colon cancer, ever. So I think, it's well and good for us to talk about the, those who aren't up to date. That number is only about 8 million. So it's more than double who've never been screened. Those who've been screened and are up, not up to date, at least they've been exposed and know what they're supposed to do. So that really is the sort of change and turn at CDC that I would like to make for us to reach out to those people. And everything we do sort of works that way, the empowering people, understanding what their needs are and what the benefits are. And again, most people don't see the benefit, especially within a really, really busy life. And so I just want to thank Anjee and Fight Colorectal Cancer. This is one of my favorite meetings, period, to come to, because you guys are in it, for the right reasons, and you work with us at CDC. Research is wonderful, but if you don't ever get it into the community, it's sort of an effort that could have been, done a little bit better. So we work with the National Cancer Institute, Dr. Lowy. Bob Kroll just retired, and they have a new director, and Catherine is her name. Can't remember. Goddard. Oh, my God, my 59-year-old brain didn't die on me. But anyway, Catherine, we've talked to her a couple times, and we're looking forward to working with partners outside of CDC. And lastly, I'll say one of our biggest efforts right now is in health equity. We've always done health equity. A program for uninsured women is a health equity program. You agree? Okay, so then when we talk about it at CDC, we got to do more for health equity. I'm like, well, what else can we do, right? We've screened 6 million women since we started the program 30 years, and not one of those women has had health insurance. So I was looking the numbers up last night, so that equates to 75,000 breast cancers that we found over the past 30 years. And part of our program is to ensure that women get into treatment. And our stats say, because we have a wonderful database to evaluate, say that 98% of those women have gotten into care and have had their cancer treated. And I don't think other systems, I don't think can, well, they might not share that number, but we are required by Congress to report that number. So that's why we have the data to tell you what we've done. But we do some fabulous work. And one of our areas to increase our reach, as she said, would be for the colorectal cancer program to be nationwide. And so when you guys go talk tomorrow, just let people know that CDC is in Atlanta and we're still there. And we're here for everybody because we serve all of you guys, the public. Thank you.
So 30 states, we have 20 more to go. So we need to continue to fund the CDC program and continue to screen people around the country. I'm really excited actually to talk about this. Dr. Carnival had mentioned that not only do we need to work with advocacy groups or federal agencies, but we also have to work with industry. And a couple of years ago, Fight Colorectal Cancer partnered with Komodo Health. So for those of you who don't know Komodo Health, they're a data claims group, software group. And when I first saw the software, the staff can attest to this. I did dance a little bit in my office because I'd never seen data so easy. I didn't have to be an epidemiologist. I didn't have to be a PhD trained individual, but I could understand what was happening in colorectal cancer, who the physicians were by county that were seeing colorectal cancer patients. We were able to overlay that with incidence and mortality. I mean, it was all the things I dreamed up of, I wish I had, was in this database, and I was so grateful. And not only was I grateful to be able to see the data as an advocacy organization, but we were able to partner with them to publish data. As Dr. Sharpless had mentioned, the drop in colorectal cancer screening. So they truly have locked arms with advocacy organizations across the country to say this data is only good if we can help change lives. And I believe that. Komodo is an amazing partner in helping us inform the efforts that we're doing and help tailor and target where we need to be to save lives. Not only prevention, but also the treatment of colorectal cancer and increase access to clinical trials, which is so important. So I'd like to introduce Dr. Usha Periyanangam. Almost had it. She is Komodo's head of real-world evidence, and she is joining us today to talk about Komodo Health and their commitment to curing colorectal cancer.
Wonderful. Thank you. My patients call me Dr. P, so Dr. P is totally fine. Thanks for the warm introduction. As Anjee mentioned, I work at Komodo Health, and we really look at bringing data and analytics and trying to make it understandable to the everyday person. But I'm also an emergency medicine doctor. And as an emergency medicine doctor, I really shouldn't have much experience diagnosing colorectal cancer, right? That's what primary care doctors do. That's what gastroenterologists do. But unfortunately, when the healthcare system doesn't give all the opportunities for somebody to come in to their doctor and feel heard, they often end up at the emergency room. And therefore, I've seen and diagnosed multiple patients with colorectal cancer. And as we start to think about where the world will be at 2030, as we said, and how many young people are currently not being seen or heard with their primary care doctors, I feel like this trend will only continue to increase until we start to make these changes here. So at Komodo Health, we really are passionate at understanding our patients, understanding patients who have colorectal cancer, and really understanding where the gaps in the care are in order to focus our efforts on increasing the standard of care for all patients, specifically younger and minority populations. So as we've heard about the incredible amount of decreased screenings that occurred during the pandemic, our personal data analysis showed in April of 2020, about 90% of what was normal colorectal screenings, colonoscopies occurring. So 10% of normal was happening and 90% had decreased. That is a huge, huge drop that we have started to try to address with increasing in screening since then, but we just still haven't made up for that huge lack of screening that occurred. So if we don't have that, and we haven't been able to make up for this lack of screenings, we really worry about where the population will be in 2030. And we've got to put a lot of effort in our communities really to reach out these populations and actually get people to go see their doctors and make these conversations happen with their doctors. So I did my part while I was listening to everybody speak. I texted my husband, told him it's time, you need to go and get your colonoscopy. So I urge you all to do the same for your families. So one of the things we really also rallied around with Fight CRC is doing other studies and research studies to really understand where colorectal cancer has a high survival rate when detected early. We really just need to address some of the disparities with policy, education, more research, investment in public health. And we know that this disease burden is not evenly distributed. And so we've spent a lot of time looking at racial disparities within colorectal cancer, especially with the Black population. And so we already know Black population has the lowest rate of 5-year survival from colorectal cancer. But our team did research showing that the average Black person who was diagnosed with colorectal cancer had 8 days longer to wait before they got their first treatment. So 8 days doesn't sound like that much, but 8 days of worry, 8 days of fear, 8 days of feeling that cancer grow inside you without having any ability to address it is astronomical, especially if you extend that to the entire population. We've got a lot of work to do. Similarly, we see that African Americans are more likely to present with metastatic disease. We found about 21% of our patients were presenting metastatic disease compared with the white population having 18%. That's a huge difference. Just addressing that will cut down some of these flags here that we are expecting to see diagnosed and potential mortality in 2030. So we've got a lot of work to do, but we also have the ability to make these changes. So as we use data to really deepen our understanding of the patients and their journey, and we can really understand when, where, and how patients experience disease, create strategies and plans to build equitable healthcare systems, and then really drive better outcomes for our patients. So Anjee, I'm really grateful for all the work of you and your team to really advocate for us and patients with this disease, but we have a lot more work to do, as you are well aware. To see all of these people advocate for increasing the patient's voice in our treatments, to address unmet needs, to accelerate research and close these gaps, we can really change policies and make a difference in lives. So thank you all for the work you do. We're really honored to be a part of this community and be a part of the fight to end this disease with our patients here. Thank you.
Hello. I'm used to being a behind-the-scenes person, but it's my time up here. Just to echo what Anjee said, what an incredible day, and thank you all so much for being here. It is my great honor to introduce our next speaker, Sharon Bailey, who is the mother of a former colleague and friend of mine and of Fight Colorectal Cancer and of many of you in this audience, Julianne Guidi-Edwards. Who is also on this poster right here. Julianne worked for Fight CRC for many years and was a tremendous advocate and had the power and determination and energy and positivity of 1,000 advocates. And she passed away in 2019, and we miss her dearly. And she would have, I hope, really gotten a kick out of today's installation and this event in this United in Blue. So we're so honored to have her parents here today with us, and I'm excited to introduce Sharon Bailey.
That was the last recording that our daughter Julianne made for either of us. She made that dedicated to her father, who's the gentleman in the back with the gray jacket. It's in a collection of songs called Songs for My Father. It was the first time that I had been able to listen to any of her recordings until now when I was preparing my remarks. And it was so good to hear her voice. And that song really embodied her spirit for the entire time after her diagnosis until she left us. She appeared fearless. Not that she was all the time, of course, but most of the time, really, really courageous. So this is a picture of our daughter, Julianne, and this is Julianne's story. Jewel was born in 1989. She had one sibling, an older brother. Julianne was a happy child, and she expressed her joy by singing, and she sang most of the time. She sang her way through nursery and elementary school, and even angsty middle school. Music kept her grounded in her years of singing with the Peabody Children's Chorus. I was with her when she saw her first opera at 12, and that's when she fell in love with vocal music. We always told her, you can do anything, and we weren't just telling her that. We really believed it, that she really could. We told her, you're smart, you have so much to look forward to, your whole life is in front of you, everything will fall into place for you if you just work hard. There are good things to come. Julianne studied vocal music and graduated from the Peabody Conservatory in 2012. But she didn't want to perform as a singer. Jewel had noticed for years that the patrons of the opera and the symphonies all had gray hair. The exposure of her friends in their 20s to any classical music in any form was through movie scores and gaming music scores. The laws about copyrights and royalties were changing, and they were cutting out any profit for the composers and musicians. Many of her friends were composers. It was unjust, and she was going to fix it. For the next 3 years, she devoted herself to a joint degree program at the University of Miami for a law degree and a Master's of Business of Music degree. By the summer of 2015, she had 2 graduate degrees and was living with her fiancé in Wilmington, Delaware. She was studying for the California Bar to take a dream job at an LA agency that represented the composers for movie scores. Life was good. Everything was falling into place. Then came the day that everything changed. Some dates are how we measure the before and the after. Before that date, you believe the future is where your life unfolds pretty much according to plan. And then one day, things go sideways, and your life has changed forever in ways you could never imagine. Diagnosis day for Julianne was July 23rd, 2015, 2 months after she graduated. 4 days earlier, she had found she couldn't pass anything. After 5 hours in the emergency young woman could have colon cancer. I remember her phone call that night. In her weak and tired voice, she told me it was a waste of her time. She was never going back there. They wouldn't believe her, that something was really, really wrong. The next day, she was desperately ill, and her fiance did take her back. This time, they knew it was bad. They inserted an Anjee tube and started doing tests. Still, cancer was not among the hypotheses. After 2 days, something shifted in her abdomen, and they were able to do a colonoscopy. And then that horrible truth was plain to see. Within 24 hours, she was transferred to Johns Hopkins for her 8-hour life-saving cancer surgery. Her talented surgeon, Dr. Sandra Fang, was her savior that day. She laparoscopically resected her colon and removed all diseased tissue that she could, including her ovaries. Julian's sorrow in losing her chance at motherhood was emotionally more profound than her diagnosis. When out of recovery, she told her fiancé, "Look, things are really different now. I'll let you out of your promise. This is more than you signed up for." Alan said, "No chance." And they were married 6 weeks later in the forest by the stream where she played as a child. We all turned away from the life she had planned and started the long process of coming to terms with this new reality. We learned how insidious this disease is, establishing itself in the body for years. Julianne's stage 4 cancer was so far progressed that her oncologist said she had had it during high school. No family history, no genetic predisposition. Jewel felt her body had betrayed her. And more than that, she felt betrayed and dismissed by every medical person she had ever seen in the last 10 years. She had felt that something was really wrong for a long time. There had been a number of unexplained fevers, a petechial body rash, and abdominal pain that her gynecologist said, lots of girls have ovarian cysts. It's not really a problem. A kidney infection that required IV antibiotics, fainting spells, and borderline persistent anemia. All these things she brought to the attention of doctors, and all of them were dismissed as no big deal. Each time was a missed opportunity to do a simple test that would have saved her life. Every time. Instead, they made her believe she was a hypochondriac. Julian's tumor tested genetically as an NRAS, and she started a standard chemo protocol at Hopkins in September 2015. 2 months into her treatment, she told me she had come to a decision. Whatever was to come, she was making the affirmative decision to be happy. Cancer had taken so much, and there was so much about her situation she accepted was out of her control, but she could control her attitude and reactions. That was the moment my daughter became my teacher. That was the moment I realized that as much as I wanted to sit in a corner in a dark room, I couldn't. If my daughter had the courage to look this in the eye and be happy in spite of it all, I was going to be by her side too. After a first round of chemotherapy, she was declared NED, and our hopes soared. Remember, we were still new to cancer. In this blessed period of remission, Julianne studied for and passed the Maryland bar exam. She looked for cancer advocacy groups and learned just how lucky she was to have had insurance coverage because of the ACA. She had time to reflect on the difference between unfair, as in life is unfair, and unjust, as in unnecessary suffering by systemic failures. In 2016, the ACA was under attack, and her health coverage and everyone like her was at risk. She became a one-person dedicated ACA advocate. Armed with her poster board and Sharpie, she started showing up at public speaking engagements and speaking out at public hearings. Politicians started listening. One recognized her at the Capitol on the night the Senate was to vote on revoking the ACA and gave her a gallery pass. So she was present in the Senate gallery when John McCain defiantly gave his thumbs down vote. She took courage from all this. Then her cancer came back. She received a second standard protocol of available chemo drugs, and at the conclusion of her treatment, her numbers were lower, but not all that good. Her oncology team put her on the last standard immunotherapy drug. Julian immersed herself in clinical research studies and consults with research oncologists. And she finally found an advocacy group in Fight CRC that actually helped CRC patients with information and understanding of the special challenges faced by young adults with CRC. She told me she had found her people. She worked for Fight CRC for a year in grassroots advocacy and helped organize the 2018 Colon Congress. Since Jewel had exhausted all standard treatment protocols, she now qualified for some promising clinical trials at NIH. We had always put our last best hope in CAR T treatment to save her. But her post-standard treatment time was all too brief because in July of 2018, she became much sicker from a lymphangitic spread in her lungs. By the time she got to NIH, they told her she was no longer a candidate. She would not have survived the CAR T treatment. Julian's last year was spent on oxygen with a clinical trial immunotherapy drug that extended her life significantly. She quietly slipped away from us on August 8th, 2019. Our daughter teacher may no longer be here, but her lessons are always with us. Her courage and compassion for others gave her wisdom beyond her 30 years. To ease the suffering of others is the most important work any of us can do. Every flag in the ground here represents not only the suffering of the patient, but also the suffering of all those who love that person. We must support the good work of Fight CRC that informs and advocates for patients. We must help the dedicated oncologists and research scientists who want nothing more than to conquer this disease. Their funding can't be a matter of politics, but one of conscience. And we must continue to give our political and legislative leaders the courage they need to make our healthcare system one that is just and one that really does care. Thank you all for being here and supporting Fight CRC and for listening to Julian's story. Here's one more song by Jewel. Maybe. Thank you.
All right. Thank you all. So I cry every time we are at Call on Congress. I think you see why. Before we transition to our next speaker, I just want to say a few words. I very much appreciate Julian's parents being here and sharing her story, and I hope that you know we loved her very much. We hired Julian on our team as a stage 4 colorectal cancer survivor, and I remember within 5 minutes, I said, no matter what happens, it's going to be worth it because she's going to make us better, and she made us better. She made our advocacy stronger. She made our voices stronger, and she made us a better group, a better focused and mission-driven organization. So thank you for being here because we truly feel her spirit every single day, and we continue to drive her dreams forward. So next, I want to... My good friend, Sung, from Stand Up to Cancer. She is the CEO of Stand Up to Cancer. And what I love about our oncology community, our cancer community, is the leadership truly believes in these causes. As the CEO of Stand Up to Cancer, I remember sitting next to her and she said, Anjee, people think I'm crazy, but I'm going to put millions of dollars in health equity before anyone else is going to really believe me. I'm going to commit to it. And she did. And that day when I met her, the RFA went out for health equity from Stand Up to Cancer. The year prior, Stand Up to Cancer had funded over $11 million in colorectal cancer research to find a cure, to support clinical trial innovation, and to push for immunotherapy. And I look at Sung, and it's amazing what Stand Up to Cancer has done. And not only has she led an amazing organization to bring awareness to research, clinical trials, better treatment options, but she has lent herself and her voice to cancer organizations across the country. So I welcome Sung, who is a champion for colorectal cancer as well as cancers across the country.
Hello, everyone. I'm so pleased to be here with all of you to call attention to the undeniable need to make colorectal cancer screening and treatment more available, more affordable, more accessible in communities all across our great country. Stand Up to Cancer is a national cancer research organization that works to accelerate the pace of groundbreaking translational research to get new and effective therapies to patients as quickly as possible to save lives now. This cause that brings all of us to Washington and to this stage today. The fight against colorectal cancer is one of the most pressing cancer issues facing our communities today. Why? We've heard from Dr. Azad. This is one of the cancers that's preventable. And if caught early, in the earliest stages, it's curable in more than 90% of the cases. The urgency we face as a society is that we have many of the tools to catch colorectal cancer as it's developing, but we're not making those tools accessible to all the people who need them. Stand Up to Cancer brings together the best and the brightest researchers and advocates and mandates collaboration among the cancer community. And since 2009, using our collaborative funding models, Stand Up to Cancer has funded over $38 million towards colorectal cancer research. Thanks to the work of our funded scientists, we have contributed to 2 FDA approvals of new therapies for colorectal cancer, and we continue to push for more progress. This year, we launched a dream team spanning 3 communities to create what we call Stand Up to Cancer zones. This is an investment in colorectal cancer screening because we know that this disease is preventable and also curable in 90% of patients if caught early. Please think about that statistic. 90% successfully treated if the cancer is caught early. We need to make colorectal cancer screening available to every adult in this country. The economic and racial barriers that keep people from getting preventative services need to be overcome as fast as possible. This new dream team at Stand Up to Cancer is combining rigorous scientific approaches and collaboration with trusted community organizations, nonprofits, advocacy groups like Fight CRC, federal agencies, and industry to increase colorectal cancer testing in the communities where screening rates are among the lowest in the country. We're especially grateful to Exact Sciences and Providence Health, one of the largest healthcare delivery systems in the United States, for this important effort, which will start in underserved communities in Los Angeles, Boston, and South Dakota before being scaled to 52 hospitals and over 1,000 clinics across 7 states. The goal for us is to create one Stand Up to Cancer zone, the entire United States of America. We have also engaged our entertainment industry partners and our celebrity ambassadors, including special messages and innovative health education materials from Jamie Foxx, Cedric the Entertainer, Chuck D, Pete Colon, who are bringing greater awareness for our common fight. We look forward to sharing the lessons from these new projects with all of you. And Stand Up to Cancer is proud to be here today and with you always in the fight against colorectal cancer. Thank you so much.
Thank you so much, Sung. It's so good to see you. It's been a couple years. I haven't seen her, and it's just so exciting to hear what Stand Up to Cancer is doing. Next, we have Congressman Donald Payne from New Jersey. He has been a champion since day one. I remember, I think it was 10 years ago, I came to Washington, D.C., and Congressman Payne welcomed Fight Colorectal Cancer and really took on our flag and said, I'm going to fight alongside you. He was one of the instrumental leaders in passing the Removing Barriers to Colorectal Cancer Screening and has co-chaired and led our first colorectal cancer caucus. Welcoming Dr. Donald Payne.
Good to see you. Thank you, and good morning. It's really an honor to participate in your United in Blue event. I want to thank Fight CRC for the invitation to speak with you today and our ongoing relationship. This event is a tribute to the survivors, caregivers, and champions in our fight against colorectal cancer. As you know, every flag represents someone affected by this deadly disease, and it is important to commemorate them here today. Colorectal cancer is the second highest cause of cancer death in the country, and it is the 4th highest cause of new cancers. This year, unfortunately, about 150,000 Americans will be diagnosed with colorectal cancer. and more than 52,000 people will pass from it. Yet, colorectal cancer is one of the most preventable types of cancer if detected early. That is why events like this are so important. They raise the awareness and encourage more Americans to get screened and to catch it early. You are fighting and leading the fight in making sure that thousands of Americans do not perish from this dreaded disease. This cause is very personal to me. I came to it because of the loss of my father, Congressman Donald Payne Sr. He passed from colorectal cancer in 2012, and I succeeded him in Congress. I wish he was still the congressman from the 10th District. Since then, I have worked to raise awareness of this disease and help save lives. Because you see, if I had not gone through this, I probably wouldn't have gotten screened myself. But on the death of my father, I figured maybe I better, go take a look and get screened. And I was over 50 by then. And when I had my first colonoscopy, they found 13 polyps. And luckily, none were cancerous. But can you imagine, had I continued down that path, the outcome probably would not have been very good. So I co-founded the Congressional Colorectal Cancer Caucus in the Congress to increase the awareness of the disease in the House. I introduced the Donald Payne Sr. Colorectal Cancer Detection Act to provide more options for Medicare beneficiaries to get colorectal cancer screenings. And I introduced the Colorectal Cancer Payment Fairness Act to make sure that colonoscopy patients would not have to pay for polyps removed during the procedure, because what had been happening is people would go for the colonoscopy, they'd go to sleep, the doctor would find polyps, and then they'd wake up to a bill for removing the polyps. Well, that exists no more, because I fought for 6 years, and now it is picked up in the cost of the colonoscopy, and people don't wake up to a new bill that they did not realize they would have. And what that does is allow more people to go, because if they're fearful that what they find is going to cost them more, some people just won't show up for the colonoscopy, and we know what happens then. So in the last 2 months, I requested that President Biden issue a presidential proclamation to declare March, a presidential proclamation to declare March as National Colorectal Cancer Awareness Month. And he, did he do it? Yeah. Oh, yes. I was honored. Well, that's why he did it so early. I was honored that he declared it on February 28th. And so that deserves. When I arrived in Congress, they told me that it was very difficult sometimes to get the presidents to award these, because if you do one, you have to do the other. But I was persistent, and President Obama was the first president to sign it. And I've been fortunate to have every president, even the past 45, signed it. So he did something right. And I introduced a resolution in Congress to support the designation of March as Colorectal Cancer National Cancer Awareness Month. Right now, I'm looking for more ways to increase awareness and funding of this disease. We need to increase screening and treatment options, ladies and gentlemen, to reduce colorectal cancer deaths nationwide. We're all here for a reason. We're either survivors or caregivers, or like me, have lost someone to this dreaded disease. My father was a learned man, a bright man, a brilliant man, but would not go get a colonoscopy. And that is the reason that he's not here today. And it is, I don't want anyone else to go through the pain that I've suffered the last 10 years without him. So we need to increase screenings and treatment options to reduce the deaths. And these events are critical in increasing supporters and saving lives. You are doing the work. We appreciate you so much. We can't do it alone. This has to be a nationwide effort, and you're on the ground during the work. So I want to thank CRC for their consummate work. We've been together for 10 years now, and I'm not going anywhere anytime soon. Thank you very much. God bless you.
One thing I will say is that Call on Congress and our rallies are super fun. They're great. We get our champions out. But one of the things, they're unpredictable. So we're running a little bit early. Our members are still coming, but we're changing up the agenda a little bit, and we're going to invite our healthcare champions to join us. And I want to give a little bit of background on our healthcare champions and why we have healthcare champions. We work with healthcare associations and professional associations to continue to push. Nancy Roach was the founder of our organization, and the one thing that she said, and Anjee is our current board chair, and it's something that, it's a legacy statement that we always say, be the squeaky wheel. And so we are the squeaky wheel here in Washington, D.C., but also with our healthcare champions. And we've turned them, and now they're our champions, and they really understand the stories of survivors and share our voice wherever they go. So I want to invite Dr. Dan Poblete and Dr. Daryl Gray, who represent the ACG, which is the American College of Gastroenterology, and the Association of Black Gastroenterologists and Hepatologists. They are amazing, and thank you for joining us. Please join us up on stage.
So it's my distinct pleasure and honor to be here, and I'm humbled, actually, by all of you, because we do what we do for you. And I want to particularly thank Anjee for this invitation. So I'm Dr. Daniel Pambianco. I'm the president-elect of the American College of Gastroenterology, and I'm a gastroenterologist at Charlottesville Gastroenterology Associates in Charlottesville, Virginia. And once again, I'm honored to be here with the advocates and patients and survivors and caregivers of Fight CRC community. The American College of Gastroenterology is a membership of over 17,000 gastrointestinal specialists, and on behalf of this GI community, the ACG is proud to stand here in solidarity with Fight CRC in this important statement of hope on this beautiful day. So thank you for bringing to the attention the alarming trends of the young onset of colorectal cancer and advocating for research and better answers. Data in February revealed that late-stage colon and rectal cancers are increasing dangerously among younger Americans, and particularly people of color, as you've been hearing this morning. While the causes of this disturbing trend are multifaceted and to date really poorly understood, to be quite candid, nonetheless, regardless of age, no one should ignore their bowel symptoms. Again, I can't emphasize that, as you've been hearing from our other speakers. And on that note, data that has been published in February in prestigious journals have shown that Americans between 20 and 39 years old experience the steepest increase in this advanced cancer. And adenocarcinoma, this incidence between 2000 and 2016 mostly affect the youngest of the non-Hispanic Black and Hispanic populations experiencing this distant staged disease. So why is this happening? The question remains one of the most frustrating parts of understanding this disease. We know that 1 in 5 younger patients with colorectal cancer have a genetic reason that increases their risk. This is why we especially need to genetically test all young patients with cancer to protect their families. Other factors that researchers are studying include diet rich in sugars, fat, red meat, alcohol, obesity, decreased physical activity and exercise, and changes in the gut bacteria known as the microbiome. But no one thing has emerged as the single likely cause of this younger onset colorectal cancer, and the answer will probably be more related to a combination of these factors. So here's the message I want to emphasize today. Again, never ignore new or worrying bowel symptoms. Everyone, regardless of age, should talk to their doctor about new symptoms such as blood in a stool, change in the shape or size of stool, or rectal pain, and again, as you've heard enumerated by other speakers. And it's important to be our own advocates, and we're all our advocates, but it's also important to not give up if not being heard. Follow your instincts. You know your body. It's incredibly important. So these symptoms should not be ignored, and particularly in young patients, young people, it is essential to talk to your doctor about this. And despite how difficult it is to talk about bowel habits and blood in the stool, no one should be embarrassed or put off talking about these issues, or certainly not self-diagnose yourself. We all need to take ownership of our health and not deny that symptoms exist. and not let embarrassment or fear stop us from talking about symptoms. Unfortunately, some younger patients can go months before they get diagnosed, as you've heard very poignantly this morning. And because of this, it's, again, important that we keep this in our minds, given that the fact that this is very prevalent. So we all need to take this more seriously. We all need to do better. We all need to work together, and that's what's humbling to me this morning here with you all here. Since colorectal cancer can be prevented, in many cases, knowing your family history is paramount. The new screening age is 45 and not 50. Colorectal cancer is one of the very few cancers that can, again, be prevented. So having these exams when you're well is again, paramount. So the age 45 now is the time to start screening. These are guidelines that have been shown to be scientifically sound by the American College of Gastroenterology, and as you've heard from the other societies of Multi-Society Task Force on Colorectal Cancer and the American Cancer Society. So screening at 45 is the new 50. The American College of Gastroenterology had been leaders in advancing this screening in African Americans at the age of 45 before this new advance has taken place. So therefore, the message from the American College of Gastroenterology is that, again, prevent cancer, get screened, encourage everyone else in your family that's appropriate to get screened to go forth. Know your family history. If you want to do something to help us, to help you, know your family history. It's incredibly important to then be able to sort of pick out what may be the potential genetic syndromes and genetic testing that can be done now. And we're working on this as an organization to implement this at a higher rate. So in this time, again, I want to emphasize that your health is your greatest possession. Therefore, lead a healthy lifestyle, get up and down from your chairs, as we just have done, fresh fruits and vegetables in your diet. So finally, in the time of COVID, please don't let your screening, your exams lapse. We, as a healthcare facility in Charlottesville, and we represent many other organizations and clinical practices, are working vehemently to get patients back in tune, given this pause that has occurred. So despite the challenges, colon cancer is still safe in the setting despite COVID, and again, it should not be delayed. So without any further ado, I want to thank you for the kind attention that you've given me this morning, and it was a pleasure to stand on this podium with honored individuals. So thank you and have a good day.
Good morning, everyone. On behalf of the Association of Black Gastroenterologists and Hepatologists, particularly our president, Sophie Balzura, our entire board, good morning and thank you. I'm Dr. Darrell Gray, co-founder of the association, and I want to personally thank you, Anjee, thank the entire Fight CRC team, thank you, Dr. Richardson, thank you, Sung, thank you for all the champions, the Fight CRC board, for making today and our work possible. You know, as you've heard and seen today, colorectal cancer touches us all. Whether it's through a family member, a friend, a coworker, someone in our church, an associate, an acquaintance, a neighbor. And at times, because of that, it can seem insurmountable. Colorectal cancer personally touched me through friends. Not too far from here, I attended medical school at Howard University College of Medicine. One of my upperclassmen, Dr. Owais Hassan, passed at the age of 42. A fellow gastroenterologist like me passed at the age of 42, a father, a husband. It touched me through other friends, such as those in the audience, like Candace Henley, founder of the Blue Hat Foundation, who says family secrets can kill families. And again, at times it can feel insurmountable, such a large problem, particularly that is disproportionately burdening communities of color, particularly black communities. But I'm reminded of a story. And the story goes, I didn't share this, but I'm a father, and so story time is cherished in our household, not only as a time of education, but it means that they're about to go to bed. So one of my favorite stories, not theirs, is What Do You Do with the Problem? And and this book is by Kobe Yamada. It tells the story of a young boy who one day recognizes he has a problem. This problem is depicted by a black cloud, and this problem follows him everywhere he goes. The more he tries to avoid it, the larger this black cloud becomes. He tries to hide under a rock. He tries to run from it. It becomes larger and larger until one day he decides he's going to face this problem, this black cloud. And he says, I discovered it had something beautiful inside. I discovered my problem had an opportunity. And so for all of us, whether you are a survivor, a champion, a researcher, an advocate, a policymaker, this problem of colorectal cancer holds such a great opportunity for us all. We can change the tide of colorectal cancer because, as has been seen, it is treatable, preventable, and beatable. And as I get ready to close, as I see people walking along this national mall, I'm reminded of one more story. And it's the story of a starfish. And some of you may have heard this story. It tells the story of one morning, a gentleman was walking along the seashore. And he noticed in the distance there appeared to be a young boy who was frantically throwing things into the ocean. As he got closer, he saw the young boy was just hurling these things into the ocean. And he got close to the boy, he saw he was holding a starfish. He said, you know, what are you doing? He said, I'm throwing the starfish back into the ocean. The man said, do you not realize that there are miles and miles of starfish? The tide has come up, the starfish have flowed onto the seashore, and it would take you forever to throw all these starfish in. The young man, not being discouraged, with a smile on his face, held a starfish in his hand as he threw one more back in and said, it mattered for this one. What we do, what each of you do, matters for the one, and the ones add up to hundreds, to thousands, to hundreds of thousands. We can have impact. I am delighted that the Association of Black Gastroenterologists and Hepatologists wants to be and can be and is part of the solution. Our mission is simple. We want to advance health equity in black communities. We want to advance science and develop the careers of black gastroenterologists, hepatologists, and scientists. And we are excited to partner with all of you. And thank you again.
Every time I hear Daryl speak, I want to say amen. He is so good. He restores me, and he reminds me of why we do what we do and what the amazing champions we have who are working alongside us. So I want to bring up our next group. So I want to bring up our next group. I'm going to bring them up as a group. But before I bring them up, I want to point out that it really matters. Leadership matters. There are groups around the country who are fighting colorectal cancer in local communities and nationally, and they have made the time to join us. And so we are bringing up the AGA right now. And they are part of the amazing group of champions that we have. And this is how Call on Congress goes. You just sort of go with it. So I would like to introduce and bring up our relentless champion from the American Gastroenterology Association. And we really appreciate her leadership. Kathleen has been working alongside Fight Colorectal Cancer on the colonoscopy loophole bill, as well as coverage for the follow-up colonoscopy when you take a non-invasive screening test. We could not make the progress that we're making without collaboration, and so her leadership has been so appreciated. Even in spite of COVID, we have continued to push. Thank you for joining us.
Thanks so much, Angie, and I'll be quick. Daryl's a hard act to follow. Really honored to be here today and so happy to be in person and actually see so many friends and colleagues in the flesh after working together closely for the past couple of years through a Zoom screen. Again, my name is Kathleen Texera, and I'm with the American Gastroenterological Association, and the AGA is a proud partner with Fight Colorectal Cancer in the United in Blue rally. And as Angie said, our organizations have worked very closely for the past decade, really, on closing the loophole bill and eliminating financial barriers to screening. And we stand with you today. We know that it is so important that Congress hears a united front as to how important it is that we invest in research that can lead to better treatments for colorectal cancer and to really get a better understanding as to why so many people are being diagnosed today with this deadly disease. And we need to continue to remove barriers to screening. We talked about the loophole bill, and we've worked very closely on guaranteeing that patients have coverage to the follow-up colonoscopy if they choose to have a non-invasive screening. It's so important to give patients choices because we found that when patients have a choice of screening, screening rates go up. So we know that also it's so important that we remove other barriers to screening that are disproportionately impacting our communities of color. And so again, I want to thank you all for being here today. Your voice matters, and we need to continue to raise awareness for colorectal cancer so that together we can help eliminate the suffering and the death from colorectal cancer. Thank you so much.
Thank you, Kathleen. Okay, so restart. We are bringing in our community champions. We have 7 organizations that are joining us. And so we couldn't call this a United by Blue and not have our sister organizations around the country share what they're doing. And we have the Colon Cancer Coalition, the Colon Cancer Alliance, the National Cancer Coalition for Cancer Survivors, the Cancer Support Community, One Cancer Place, the Colon Club, and C4. And we're going to invite all our representatives up on stage and give everyone a couple minutes to share what they're doing and a few words of wisdom with us today. And Blue Hat Foundation. I was looking at you, Candace. I was looking at you and I got confused. But it is pretty amazing. I think that as cancer survivors, we want to see organizations across the country partner and collaborate. And so really seeing the stage full of advocates and organizations who are in this fight together, it's a really proud moment. So thank you so much.
Hi, everyone. My name is Erica Hanson Brown, and I'm a patient. I'm also a survivor, a cancer survivor. Do I need to hold this, or can I use this? So I have notes because I want to be succinct. 19 years ago, I was being treated for advanced colon cancer. Like most patients, I had no awareness of a possible landscape of support and compassion that might welcome and support me. I was alone. Today's cancer patient, I want you to know, feels alone as well. Cancers of every disease. But there exists a landscape of compassion, and we're here to tell you about it. One Cancer Place, and I'm the founder, provides the front door, the invitation, the welcome to the rich offerings of today's landscape of compassion. We proudly named the landscape of compassion Patient Land. Many of you are starting to hear the term cancer land when patients are talking about the experience. So we want to make it even more expressive of the patient experience. Patient land will be made up of patient groups. For the colorectal cancer patient, we have organizations such as are all represented here, the Blue Hat Foundation, the Colon Club, Colon Cancer Alliance, Fight CRC, of course, and we at One Cancer Place are at the front door, welcoming, ready to welcome, with veterans of the cancer experience. What we do is we greet you like the long-lost friends and companions that you are at our front door. We connect and guide you into the landscape of compassion that we call Patient Land at One Cancer Place. Thank you.
Good morning, everyone. It's so exciting to be here with you all this morning on this beautiful DC day, and thank you to Fight Colorectal Cancer for bringing us all together for this really critical event. And thank you to the other speakers, partners, advocacy groups, government officials, members of Congress. I am honored to be standing alongside you all today as we raise awareness, honor those who have been impacted by this disease, and demand action. I'm Rachel Solomon. I'm the Senior Policy Director at the Cancer Support Community's Cancer Policy Institute. As the largest professionally led nonprofit of cancer support worldwide, the Cancer Support Community, including our Gilda's Club partners, is dedicated to ensuring that all people impacted by cancer, including colorectal cancer, are empowered by knowledge, strengthened by action, and sustained by community. We work to support and elevate the patient experience in 3 areas: direct services, research, and policy. And since the signing of the National Cancer Act over 50 years ago now, we've seen incredible advancements in the ability to detect, diagnose, and treat cancer. But we still have a very long way to go. A lot more work needs to be done. As mentioned this morning, colorectal cancer is the 2nd leading cause of cancer death for both men and women. And communities of color continue to be disproportionately affected by colorectal cancer and have a higher likelihood of being diagnosed with late-stage diagnosis. And as we see here today, visually represented behind me, colorectal cancer incidence rates are increasing among people under 50 years old. As Dr. Sharpless highlighted this morning, the COVID-19 pandemic has not only strained our healthcare system, but it continues to impact the continuity of care for people impacted by cancer. Colorectal cancer can be prevented if caught early through timely screening, but as we've seen through the pandemic, those cancer screening rates have significantly dropped. And since there is no national tracking system, we don't know who have actually received those screenings. As we've said throughout the day, screening saves lives. It is critical that people, especially at those high risk for colorectal cancer, who delayed or missed their colonoscopies, get screened. Don't delay, talk to your doctor. With closing, I'm glad we're all here together to take collective action to break down barriers to care, increase equitable access to colorectal cancer screening, advance cancer research, reduce cancer disparities, and really bring about meaningful advancements to improve the lives of patients, survivors, caregivers, and their families. Thank you so much, everyone.
Hello, my name is Haley Smoot, and I am the Director of Public Policy with the National Coalition for Cancer Survivorship. I am also, I lost my dad to colon cancer in 2017, so I have a personal connection as well, and I was only 28 at the time. So our organization, NCCS, we advocate for everyone who's touched by cancer, and we do this by focusing our policy priorities on improving the quality of life and quality of care for cancer survivors. And so we're really excited to be here today and be partnering with Fight CRC and all these other organizations up here today because, you know, it's important to raise awareness of such an important issue. And as you've heard today, you know, more and more young people are being diagnosed with colorectal cancer, and it's estimated that, you know, as we've heard today, that it'll continue to increase. So, you know, it's really important that we, like I said, raise awareness of such an important issue. And so we found, every year we do our State of Cancer Survivorship survey to raise, you know, to learn more about the experiences and the needs of cancer survivors. And we found that there are extreme disparities, significant disparities for in accessing quality health care, especially for the younger population or for those under the age of 40. So this population, they were less likely to rate their cancer care as excellent, and they also, you know, experience more side effects like mental health issues and extreme fatigue. So, you know, we're happy to be here today, like I said, to be raising awareness of such an important issue. And of course, you know, it's important to focus on prevention, but we should also focus on making sure that everyone who is diagnosed with cancer receives the quality cancer care that they deserve. Great, thank you so much.
Good morning, I'm Phone Gallagher, and I'm here representing the Colon Club. As my husband likes to say, you're not just a member, you're the president, you know, it's so okay. But, you know, one of the things that I really found within the Colon Club is other people like me. You know, we've talked a lot about the early age onset and diagnoses that is on the rise, and it's been such a difficult thing to look around in a cancer center and see that you're the only one who is so young. And so we provide support to those that were diagnosed under 45 as well as their community of support. And what that means is, you know, retreats for providing the healing and building the advocacy element so that people can go and continue to spread the word and be able to join events like this to continue to educate and build that awareness. What do we want? We're here to ask for more. You know, along with Fight Colorectal Cancer, we want to ask for more what? More time to meet our goals and accomplishments in our lives, because that's so often interrupted. More time to be with our families, and because we're so young, a lot of us, more time to simply see our kids grow up. So we thank you for this opportunity to be here and to join you in this, and we're just so proud to be partners in this. Thank you.
Hi everyone, I'm Erin Jarbuz, the Health Policy Manager for Fight Colorectal Cancer. I'm just pausing this because we have Congresswoman Jackson Lee here, and she has served her constituents and the American people for 27 years. And in that time, she has championed many issues, including access to health care and funding for cancer research. But 13 years ago, she was also a champion to a young woman just out of college who lost her mother to colorectal cancer. And Congresswoman, it is my honor to introduce you and to take this time to say thank you. At the time, I didn't quite grasp it in my grief, but you were a blessing to me. And when my mother was dying and when she passed away, the Congresswoman called me every day. She prayed with me. She gave me words of strength and encouragement. She gave me all the time I needed with my family. And when I came back to DC, she took care to give me a lot of maternal care and love. And I will never forget that. And I'm grateful to you always. Thank you so much, Congresswoman. This is Congresswoman Jackson Lee. Sorry, I didn't mean to cry.
Now you're in my life again. I love it. So blessed to be here this morning. To all of you who are gathered, what a sobering place to come. And I hope you will see that this stand-in mom did a great job with Aaron, did we not? Would you give her a very big hand, please? A loud applause. What an amazing young woman, but more importantly, what an amazing task we have. Let me, as I said, speak from the heart, just to acknowledge that I think a lot of people as young as I am, I'm Aaron's age, woke up a little bit because of Chadwick Boseman. But there are lives like Aaron's mom who represent the greatness of America, who are silent victims or victims unknowingly getting to stage 1, stage 2, stage 3, stage 4, and dying. That's why we're here today. And I'm so excited to have you come and have your face shown. Those who mourn their loved ones, those who may have been blessed to recover because of early detection, those men in particular who can wake up that it's okay to go to the doctor. It's okay to get that test. Don't imagine the test. Just go get it. Because imagining the test is going to keep you in your house, at your office, on the track field, playing basketball, because you're just not going to go what you have imagined. And this cancer painfully reminds us by those who die. And they die when you first hear that John or Mary or Jose or Ahmad or someone by the name of Mr. Chin. Religions are varied, and you hear, oh, they're sick. And then you hear they've died. And that is because this is a fast-moving cancer. In the United States, 2022, there are 106,180 new cases of colon cancer and 44,850 new cases of rectal cancer. So colorectal testing is crucial. From 2013 to 2017, incidence rates dropped a little bit, but this downward trend is mostly in older adults, masked a rising incidence among younger adults since at least the mid-1990s. From 2012 through 2016, it increased every year by 2% in people younger than 50 and 1% in people 50 to 64. So it's not only the love of Erin's life, her mom, and the moms and dads that are here. It is among younger adults who are without any vulnerabilities. They are Superman and Superwoman, or the Black Widow. They can't be harmed. And so I want to thank you all who have come. I dressed for you to let you know I'm with you purposely this morning. And I will wear these colors throughout the day to be able to enhance the 1.5 million survivors of colorectal cancer in the United States, to see the death rate drop, to see loved ones return home to their family members, and to stop hiding, stop running, stop fearing, stop dying. Stand up to live. Stand up to live. And so I can't thank this association more, and all of you who have come, in the name of family members, in the name of friends. And I thank you for letting me see my Erin and putting us in a place that our memories warm us. But I came in the midst of my Judiciary Committee meeting as the phone is telling me to come back, because you are important to America, and you're important to me. Count on me in terms of the legislation that I didn't want to recount. It's a lot of it. Have the sense that I'm here for you, and as Erin will tell you, when I introduce legislation, it gets passed. I'm getting ready to sign the Violence Against Women Act, finally, that's gotten passed in a few minutes at the White House. But I will be there for you. And if I can remind you, words of Maya Angelou said, show me who they are, and that is who they are. Show us who you are and that you are fighting for, and that will be who you are. And as I often say, Lord, lift him up where the eagles fly. Lord, lift you up where you belong. Lost a family member, suffered colon cancer, fighting to save someone. Let the Lord lift you up where the eagles fly. God bless all of you. The fight is in us, and the victory is because of each and every one of you. Stand up to beat colon cancer. Stand up to live. Stand up for the loved one that yet has gone. God bless you all. God bless the United States of America. I just like doing the fist. You know? There's power in the fist. It may be for a reason, but there's power in the fist.
I really don't know how to follow that. I mean, really. I think we should just, Thank you. Thank you, Representative. I'm Erin Peterson. I'm the Senior Director of Mission and Partnerships for the Colon Cancer Coalition. We're a national grassroots organization working in local communities, mostly on the screening issue. We're wanting to screen our underserved populations. We want to make sure that those that are unaware of screening get their screening, and that we work to fight to make sure that that happens. We are excited to be here with our partners. I'm sorry, I wasn't prepared for how emotional this day would be either, so I've completely kind of lost all my prepared remarks, but
Thank you all for being here. Thank you to Fight Colorectal Cancer for having us, for bringing the advocacy community together, for putting this really beautiful emotional display on the mall. We are here to advance whatever we can to get more people screened and save lives in the process. So thank you very much for having us.
Morning, everyone. My name is Aaliyah Langley, and I'm here representing California Colorectal Cancer Coalition, or C4. I'm currently a Master's of Public Health student at George Washington University, and I wanted to get a public health degree. I was always interested in it, but through the COVID-19 pandemic, we saw a lot of health disparities just widen, and we saw public health professionals step up, and I wanted to, be a part of that movement. And also, at my time at GW, I've also learned how important it is to have strong public health policy, like colorectal cancer policy. I as well have a personal family history of colorectal cancer. I lost my grandmother a few months ago to CRC after a very short, had no symptoms or anything, and then had diagnosed stage 4 and was dead within under 2 weeks. So, and I come from a family with a lot of medical professionals, and this definitely gave us a new perspective on trying to make sure we prioritize colon health. And this is a whole separate issue, but when you have someone who is showing, early signs of cognitive decline, like dementia, that can pose challenges as well, like we went through. But like I said, it did give my family a new perspective in making sure that colon health is prioritized, and I'm happy to be here today and glad that I've been being able to work with organizations like C4 to help the fight. So, so like I said, through GW, I've been working with C4, and as a part of my master's project. My work with C4 has emphasized even more to me how much vital support is needed for those communities most at risk, including finding ways to improve equitable healthcare through community-based interventions. C4 just went through a process of doing a community grant cycle. We gave out $50,000 to 5 different organizations, and they'll be doing the work within the next year. I would just urge any policymaker to take colorectal cancer seriously and support organizations like Fight CRC and C4 that are working every day to improve and to make changes for those most at risk and their families. So thank you very much for being here.
Hi, everyone. Thank you so much for having me, and it's such an honor to be up here with all of you and to be here with you all. I'm Alexandra Miller. I'm the Senior Director of Community Engagement for the Colorectal Cancer Alliance, and I am standing on tiptoes to reach this microphone. The Colorectal Cancer Alliance is here to end colorectal cancer. We're doing that through screening, through caring for those already impacted, and for funding research so we understand the disease better, why the disparities exist. And we're doing that with a focus on equity and empowerment. And I love this question about what we want to see more of. Definitely want to see more of those federal funding dollars, so legislators, if you can hear me. But also want to see more collaboration. I think a lot of us want to see that, and today is a wonderful example of it, so thank you so much. Yes, plus for Fight CRC for that. The last thing, and maybe my deepest hope, is that there will be more of us advocates. I hope for more diversity of representation so that we can think of better and better solutions together and reach every community that's impacted by colorectal cancer, because that's everyone. And I hope for more people so that this is, a cause that everyone rallies around, like HIV/AIDS communities and breast cancer communities were able to do before us, simply because it's such a preventable, prevalent disease. That's what makes us all so nuts, right? Why are we still looking at 50,000 deaths a year? I think most of us here have some personal suffering attached to colorectal cancer and are moving the needle in the face of our own trauma. And that requires really heroic stamina. And I am so grateful to all of you, because it's almost certain that if you come to the advocacy community, you will love and lose again. And so I'm deeply grateful to all of you, and I really hope that we will see the day when there are more people standing with us just because it's important. 1 in 24 people is a whole lot of people. If someone knows 24 people and cares about 24 people, they should care about colorectal cancer. We'll get there.
Good afternoon. I am considered, like Erica, the OG of the group, because I have been here almost 19 years. Thank you, thank you. My name is Candace Henley, and I'm the Chief Surviving Officer of the Blue Hat Foundation. The Blue Hat Foundation was born out of healthcare disparities, because when I was advocating, I kept asking if communities of color have the highest rates of incidence and death of colorectal cancer, why aren't you in those communities? And I kept hearing, we need funding. And it pissed me off. Doesn't take much, I'm a fighter. But it pissed me off because when it comes to communities of color, we always need more funding. We always need more something, but we don't have more caring. And that's the issue. We need more caring. It doesn't take money to go into a community clinic, a hospital, and to ask, what is it that you need? What does the community you serve need? It takes listening. It takes stepping down from your meetings. I'm so tired of meetings about underserved. Those meetings lead to nothing. They lead to more meetings and more deaths. So while you're meeting about what to do about the underserved community, more people are dying because you haven't put anything into action. So my call to action to you is to stop meeting, stop talking, and go into the communities that need you. The underserved communities need you. They don't need any more meetings. I get calls and emails that saying, my sister died from colon cancer today. My husband was diagnosed with colon cancer. I sit with patients who go through red tape. So we want to talk about disparities. The red tape in the institutions contribute to these disparities. So while we're talking about funding, let's talk about removing red tape from institutions that keep communities of color from being treated on time. I'm dealing with a patient now who needs a colonoscopy, but because the process requires them to be seen by another clinic that's associated with the hospital, although they have a navigator at this clinic, they have to be seen at this clinic just to get a colonoscopy. So can you imagine the hoops? It's already stressful thinking about getting a colonoscopy, right? And especially if you're experiencing symptoms or you have a family history. And now you have to go through red tape just to get a test. So we're turning patients away because of the red tape in institutions. So while we're talking about disparities, let's add the red tape and let's remove the institutional red tape so patients can get treated, so patients can get the tests that they need, the on-time screening. So that's my challenge to all of you who are in a position of power. Challenge your institutions to ask them what the processes are so that patients can get screened on time at your institutions. Because what does the funding matter if they can't get the screening? It means nothing. So I hear the stories. I see what it does. I am a product of healthcare inequity. I lost everything because the system didn't see me. We need to stop seeing people for their finances and for their colors and see people as people, because everyone in this world has a right to the best treatment, the best opportunity to save their lives. And you can help that. So let's end inequities by doing our part and seeing each other as human. There should be nothing that you see in another human being that you don't see as being someone that's loved. So thank you for being here to support us and support Fight CRC and call on Congress, and for doing your part to help us in this disease and to fight disparities outside and inside the institution. Thank you.
I am so honored by every single person on this stage because we stand in solidarity against colorectal cancer, and every single organization on this stage recognizes these flags behind us as lives that we could save, lives that we are obligated to save over the next 8 years, because we don't want to come here in 2030 to steal the words of Dr. Richard Goldberg and have gravestones. These are lives that we have to save, and I am so honored to be fighting alongside these organizations who are committed to this fight. So thank you so much for joining us. Let's take a quick picture and then we'll turn this over. You know, Anjee, be really careful. The news always covers these stories about industry and advocacy, but this is our charge, is not to allow industry to influence us, but for us to influence industry, and to make sure that we carry the stories of survivors and the needs of survivors and caregivers, and share them with our industry partners to better and improve the lives of patients. And I am so honored by our champions who've shown up and truly thought about what they can do to join us, to fight for more, and to be a champion for the 1.5 million colorectal cancer survivors in the U.S. So I want to be joined by Guardant Health, Genoscopy, Pfizer, Exact Sciences, Natera, Intuitive, and Taiho.
Well, thanks, everyone. My name is Mary Dorshank, and I'm with Exact Sciences, and we are so honored to be here with all of you today, and I want to express my sincere thanks to the Fight CRC team, to Anjee, to Aaron, to Molly, to Andrew, and to Olivia, and those of you I haven't met yet. We've had the great honor of working with Fight CRC very closely for the past few years, and we've seen the amazing work that you have done, and we are big fans of yours. I'm here on behalf of Exact, and there's 3 things that we wanted to share with all of you. And the first is that Exact Sciences stands shoulder to shoulder with you. We know that we at Exact Sciences, like you, we are cancer fighters, and our mission is to eradicate cancer and to eradicate suffering. And I know that the work is hard, but please know that we stand shoulder to shoulder with you, and you are not alone. The second thing I wanted to say was that your voice matters. We know that it's hard to come up here and share your story. It takes a certain something to dig deep and really try to stand up and tell what has happened and what has been really, really difficult in the most personal and raw way. But when you tell your story, you bring a credibility and authenticity that everyone needs to hear. And in that voice, you have great power. So please accept the thanks on behalf of all of us. and please know that you are using your voice for good. The third thing that I wanted to say, and this is the best part, is that it's working. And how do I know it's working? It's because of what Congressman Donald Payne said. For those of you who have been at this a while, you know that a year ago this past January, we finally passed the Medicare loophole bill and got that closed. And just like Dr. Sharpless said, in May, we were able to convince the U.S. Preventative Services Task Force to lower the screening age to 45, which means that in accordance with the Affordable Care Act, it now has to be covered by insurers free of cost sharing. And then just this past January, the administration decided that colorectal cancer is a full continuum, and that for all those tests that are positive, if you have to get a follow-up colonoscopy, that will soon be required to be covered free of cost sharing. These are amazing wins, and I'm not even talking about including the wins that we've seen in Medicaid, that we've seen at the state level with Rhode Island and Arkansas and Kentucky and California and Texas. Those types of wins don't just happen. They happen because we have relentless champions. And so with that, I want to offer you our support. I know tomorrow's going to be a fantastic day, and that we're going to do right by the people represented by the 27,000 flags behind us and the light that they represent, because it is our obligation to stand up for their light. So thank you.
Hi, my name is Ed Banfi. I am Vice President of Marketing at Genoscopy. We are a startup diagnostics company in St. Louis using stool-based RNA as a colorectal cancer screen. And so what we are looking to do is not just detect cancer, but also detect advanced adenomas with a non-invasive test, and hopefully bring prevention to the world of non-invasive screening tests. We're very excited to be here. This is really the first event we're attending, and you know, we are fully on board with the idea of being relentless champions for hope, for finding cancer earlier, for preventing cancer. And thank you, Michelle. Thank you, Anjee, for everything that you do, and look forward to tomorrow's calls. Thank you.
Good afternoon, everyone. My name is Julie Hamburg, and I'm the Director of Patient Advocacy for Guardant Health, a leading precision oncology company. I am so proud and honored to be a part of today and to be standing alongside our incredible partner, Fight CRC, and all of you against this amazing backdrop to advocate for more in our collective fight against colorectal cancer. At Guardant Health, we believe that the answers to conquering cancer are in our blood, and we're working hard every day to bring blood-based testing to the forefront of colorectal cancer to help transform the patient's journey. Today, our tests are enabling timely and targeted therapy selection for CRC patients with advanced cancer, as well as helping to identify residual disease and recurrence in early-stage patients. In the spirit of more, the goal of our tests is to give patients more insights so they can make more informed decisions around their treatment and their care, and have a chance for what matters most, more time. Most recently, we've turned our attention to the nearly 30% of adults who are not up to date with their colorectal cancer screening, and we're aiming to deliver a simple and an accurate blood test that can detect even the earliest signs of colorectal cancer in asymptomatic, average-risk patients. We're hopeful that this will improve screening rates once and for all and help save more lives. But we know we can't go at it alone, and that partnership is everything. With approximately 53,000 lives lost to colorectal cancer each year, and it likely to become the #1 cancer killer for young people by 2030, there is a lot of work to be done. And the time to act and to demand more research, more funding, more access to innovation, more equity, and more focus is now. As we all know, colorectal cancer does not wait, and neither can we. We commend Fight CRC for spearheading this important moment in time and for leading the charge and advocating for all of those impacted by this disease. Patients, survivors, caregivers, advocates, family members, we are truly united in blue with all of you. This is personal for all of us. We know that the best way to make meaningful change in colorectal cancer is together. And at Guardant Health, we are more than ready to pull up our sleeves and get started. Thank you so much.
Hello, everyone. I'm Rick Sauce from Natera, and I'm so honored to be here to help support Fight CRC and their vision for this campaign and installation. A few days ago, we helped install these flags along the mall representing the greater than 27,000 people under the age of 50 expected to be diagnosed with colorectal cancer in 2030. This number is staggering, which unfortunately continues to increase and is the reason we're all here today. When I was actually helping set these flags up, originally there were only a few in the ground, and as they started to come together, you couldn't help but feel a sense of shock and awe. And I'm 33, and listening to all of you today, I personally can't wait to get screened for the first time. But I'm here representing Natera, a leader in cell-free DNA technology, with an oncology testing portfolio that includes our hereditary cancer test Empower, our comprehensive genomic profiling assay, Altera, and our flagship personalized molecular residual disease test, Signatera. Our tests are currently being used with patients all around the world, and it provides them with more information to help them and their care teams. We believe that all patients should have access to tests that are helping them and their clinicians make more informed decisions, and this is why we're supporting Fight CRC's efforts to lower barriers to access, improve health equity, and encourage representation from all communities. We believe that each patient is as unique as their cancer is, and that's why we've taken a personalized approach to cancer management. Thank you, and please come connect with me during the event, and I'd be happy to answer any questions you have, and if I can't, I'll connect you with the right person at Natera that can. Thank you.
Hey, good afternoon. Bob Donovan, and I'm with the Pfizer Oncology Organization, and I lead our efforts within advocacy for melanoma and colorectal cancer. And also thank you, Anjee, Michelle, and Molly for the invitation. Sitting here the last few hours, I am truly in awe of what you all do, your spirit, your courage, your determination. I feel personally attached to this, having lost a grandmother years ago, but also a colleague who was diagnosed at an early stage, and successfully still winning that battle. I've also had the privilege of working with Fight CRC for the last 2 years. It's been a great relationship. And I just want to reinforce again, it's been said that to make this change happen in 2030, we need to develop partnerships, collaborations, share expertise, and have that fight, that drive. We can't make that change. And I think I speak for myself and many here that I look forward to the day in 2030 when we're putting flags of victory behind us. Many thank yous.
Hi, I'm Andrew Zebrak. I'm with Intuitive Surgical. I'm really excited to be here with you today. I just wanted to briefly say that we're proud to work with Fight CRC on their advocacy priorities, including patient education, the need to increase screenings, and also more research funding. Thanks again for having me, and look forward to a great day tomorrow.
Good afternoon. I'm Nick Edwards, Senior Manager with Taiho Oncology. And because they don't trust me, everything I usually say is on script. So if they're listening right now, they're going to be very nervous. But first and foremost, as a former caregiver who lost his uncle to colorectal cancer, young onset, I just can't thank you all enough for being here, for sharing your stories. I always forget with Michelle and Anjee that when I come, my heart is going to be tugged and memories are going to flood back. So thank you all for being vulnerable, speaking up and speaking out. So now to the script part, and now compliance can resume monitoring me. On behalf of Taiho Oncology employees everywhere, thank you for your participation in Fight Colorectal Cancer's United in Blue rally. Today's rally and Fight CRC's work every day helps bring hope to all those impacted by cancer, including patients, through informed patient support, impactful policy change, and breakthrough research endeavors. We at Taiho Oncology are honored to be sponsors of Fight Colorectal Cancer's Colorectal Cancer Awareness Month activities and their programs that play a critical role in the care and support of patients, survivors, and caregivers navigating a colorectal cancer diagnosis. We are proud to stand alongside you and remain committed to helping create a better future for patients living with cancer. Thank you.
Thank you guys so much. Thank you for our industry partners who join us every single day in this fight. I'm going to continue to say a few thank yous, but while I'm saying thank you, I'd like all our staff and board members to make it up to the stage. So all staff and board members, I want to thank Amgen, Daiichi Sankyo, BMS, Einstein Medical Center, Exact Sciences, Genentech, Guardant Health, Intuitive, Merck, Natera, No Shave November, Seagen, and Taiho Oncology, and especially to BMS. Our toilet installation would not be complete without them. So if our staff and board members could come up as we close, that would be awesome. If you could join us on this very slick stage, please be careful. And Elizabeth, you get to come up too. Come on. Awesome. Is everybody up here? Don't hide. Come on. All right. This is the largest call-on Congress we've ever hosted. We have hundreds of survivors across the country who have joined us, caregivers. We have members of Congress who stand alongside us. We have directors of federal agencies. We have colorectal cancer nonprofits from around the country who have joined and partnered with us. We have industry partners who take this very seriously and are listening. But what I want to really say in closing, because it's so important, is that the heartbeat of this organization and the leadership of this organization comes from our board of directors and our staff. Fight Colorectal Cancer is a national advocacy organization to empower survivors, caregivers, and family members, and that empowerment is on the minds of our staff every single day. And these individuals behind me are board members and staff members, and every single day they are fighting for you all and relentlessly working hours beyond the normal human sometimes. And so I want to thank them and recognize them, and I want you to know, if you're watching, that Fight Colorectal Cancer, every single individual who stands on this stage is fighting for you, and when you're ready to advocate, we will always be here. So thank you for joining us, and thank you for fighting alongside us.